Is it medical negligence for an ICU that forced my mother to go to an LTAC and didn't prevent sepsis and didn't feed my mother in the PEG well enough or turn her enough and develop pressure sores on a ventilator with a tracheostomy? That is the question I'm going to answer today. My name is Patrick Hutzel from IntensiveCareHotline.com, and this is another quick tip for families in intensive care. So this question forms part of a medical record review that we've done recently for one of our clients. And, the family is pretty distressed, thinking that, the ICU wasn't acting in the best interest of their mother. That unfortunately ultimately led their mother to pass away. And that's why I always say, you need help from day one. You can't, medical record review is all fine, but the bottom line is you need help when you have a family member in intensive care. You don't need a medical record review after it's all said and done, because then it's often too late. Let's look at the answer. So during an acute phase of sepsis, feeding can often be delayed or restricted because of the body's inflammatory response, and metabolic changes can make it difficult to digest and absorb nutrients, potentially leading to complications. Feeding during the acute phase of sepsis can also increase the risk of complications such as aspiration pneumonia, vomiting, gut ischemia. The priority is always to stabilize the patient and address the underlying infection, and nutritional support is often deferred until a patient is more stable. So sepsis can cause significant dysfunction in the gastrointestinal tract, including reduced blood flow, impaired motility, gut motility, I should say, and increased permeability, which can impede the delivery and absorption of nutrients. So it is important that end-of-life wishes are honored. Respecting a patient's wishes and values at the end of life not only honors the patient's life, of course, and personal belief, but also provides dignified conclusions to someone's life's journey. End-of-life ethics navigate complex decisions of medical care and treatment options, and the right to refuse treatment or the right to ask for treatment alleviate patient sufferings and limit treatment options at the end of life, maintaining a patient's dignity, respect throughout the end-of-life process. But the situation also raises several serious concerns that might point to medical negligence. Determining whether that qualifies legally depends on specific facts and documentation. Here is obviously a breakdown. Well, whenever there's a forced transfer to an LTAC, LTAC, by the way, stands for long-term acute care. The concern here is that if ICU pressured or pushed for the transfer despite a family's objections, or your mother not being medically stable for a transfer, it could be questionable. Is it negligence? It depends on whether the transfer went against established medical guidelines or lacked informed consent. Forcing a transfer without proper planning or medical justification can sometimes be grounds for a complaint. Next, sepsis development concern. Sepsis is a common but serious complication in ventilated and immobile patients. If there were signs of infection that went untreated or unnoticed, this might be negligence. If sepsis could have been prevented with proper hygiene, turning schedules, or wound care, it may suggest a failure in standard care. Next, inadequate feeding through the PEG tube. Concern: malnutrition or dehydration through improper PEG tube management is very serious. Is it negligence? If staff didn't monitor intake, didn't flush the tube, or let your mother become undernourished, that may be a deviation from standard care. Failure to turn and repositioning. Concern: not turning patients regularly can lead to pressure ulcers and infections. Is it negligence? Pressure area care is one of the most basic standards in ICU and LTAC. Failing to do this could definitely be considered negligence. So what can you do? Like we always say here at IntensiveCareHotline.com, request medical records. Get your mother's full medical chart, including nursing notes, turning schedules, nutrition logs, wound care documentation, and infection tracking. File a complaint. You can file a complaint with the State Medical Board, Hospital Administration, or Department of Health, and file for a legal review. Medical malpractice attorney can review records and help determine if this rises to the level of legal and medical negligence. So, like I always say, the biggest challenge for families in intensive care, simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. So that's exactly what you are up against here. And that's why I'm saying you need help from day one when you have a loved one critically ill in intensive care. 99.9% of families in intensive care completely underestimate how critical and dangerous it is to have a loved one in intensive care, and let things unfold. You need to understand from day one what's exactly happening. What are your rights? What questions do you need to ask? Are ICU teams really doing the right things? You need a second opinion from day one, so you're not flying blind. I hope that helps you answer your questions. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse unit manager for over 5 years in critical care nursing, and I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very confidently say that we have saved many lives for our clients in intensive care. And you can verify that on our testimonial section at intensivecarehotline.com. You can verify it on our intensivecarehotline.com podcast section, where we have done some client interviews. And I can also confidently say that our advice is absolutely life-changing. Once again, we have saved many lives over the years for our clients and their families in intensive care. Once again, it's all documented and verified on our testimonial section and on our intensivecarehotline.com podcast section with client interviews. And we have a growing number of clients and families that we have helped over the years, and you can join hundreds and hundreds of members and clients that we helped over the years. If you go to intensivecarehotline.com, and if you call us on one of the numbers on the top of our website, or if you send us an email to support@intensivecarehotline.com with your questions. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. I also talk to doctors and nurses directly with you on your behalf, and I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And we also have a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to me and my team 24 hours a day. Also exclusive access to 21 ebooks and 21 videos that I've personally written and recorded, and all of that will help you to make informed decisions, have peace of mind, control, power, and influence. And once again, all of that you get at intensivecarehotline.com. Contact us through the website by calling us or sending us an email to support@intensivecarehotline.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.